Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Kallmann syndrome. Kallmann syndrome is a rare genetic disorder that primarily affects the development of the gonads and the sense of smell. It is a form of hypogonadotropic hypogonadism which is characterized by delay or absence of puberty, impaired sense of smell. So there will be delay or absence of puberty and an impaired sense of smell. Individuals with Kallmann syndrome often have underdeveloped or absent gonads, like in male, testes will be absent or underdeveloped. In female, ovary will be absent or underdeveloped. That leads to infertility. One of the distinctive features of Kallmann syndrome is anosmia, the inability to perceive odors. This is due to the impaired development of the olfactory bulb, which are responsible for processing smells. So what is the pathogenesis? During embryonic life, in the olfactory epithelium, there will be also the gonadotropin releasing hormone producing neurons. This neuron will migrate from the nasal placard through the cribriform plate of ethmoid bone through the olfactory bulb to the hypothalamus. In the hypothalamus, this gonadotropin releasing hormone will be activated. They will release the gonadotropin releasing hormone. This neuron will produce the gonadotropin releasing hormone that will produce the follicle stimulating hormone, luteinizing hormone from the anterior pituitary. And those will help in the development of the ovary, testes, and their function. Okay, so in case of Kallmann syndrome, this migration of gonadotropin releasing hormone producing neurons from the olfactory placard or nasal placard is not possible, or it is disrupted. So there will be no gonadotropin releasing hormone producing neuron cannot migrate from the nasal placard to the hypothalamus, so no FSH, no luteinizing hormone. So there will be no function of the ovary and testes, or those may be absent, those gonads. So if we go to this area, this is the gonadotropin releasing hormone. Okay, here it is produced from the hypothalamus, goes to the anterior pituitary, produce the luteinizing hormone and follicle stimulating hormone. These two hormones act on the testis to grow the testis, as well as production of the sperm. These are not possible here develop, so there is no spermatozoa or very much minimum spermatozoa. So if the testis is not developed, sperm may be totally absent, maybe a few. That can be used for in vitro fertilization. Here in female, ovary will not produce ovum, so a female usually is infertile in case of Kallmann syndrome, like a male is sterile or infertile in case of Kallmann syndrome. So ovum coming from the ovary is not developed. Spermatozoa comes from the testis. Sperm is not developed, is not formed. There is no testis development. Okay, hormone lacking here, testosterone in male and estrogen in female. And the characteristic of the male, like that of boys, growth of muscle tissue, enlargement of genitalia, facial, pubic, axillary hair does not function properly, does not grow like normal male. In female, broadening of the hip, menstruation, development of breast, pubic and axillary hair are not developed. Okay, so these are the features and pathogenesis of Kallmann syndrome. Genetics of Kallmann syndrome, we have multiple. This is a genetic disorder, and its inheritance pattern can be either X-linked recessive, autosomal dominant, or autosomal recessive. Several genes have been associated with the development of Kallmann syndrome: KAL1, FGFR1, ProKR2, K2 and CHDH. Okay, so we have multiple genes associated with that of the Kallmann syndrome, and this is a genetic disorder. It may be X-linked recessive, maybe autosomal dominant, maybe autosomal recessive. So manifestation vary from person to person and depending on the environment as well as the genetic mutation. Mutation in this gene can disrupt the gonadotropin releasing hormone. Gonadotropin releasing hormone is crucial for the onset of puberty, sense of smell, and the development of secondary sexual characteristics. Clinical features of Kallmann syndrome: delayed or absent puberty, hypogonadotropic hypogonadism, anosmia, that is lack of sense of smell, skeletal abnormality like osteoporosis, renal anomalies like renal agenesis. Okay, we may have also cleft palate. We may have also non-development of the olfactory system of the brain. There may be chance of dysgenesis of corpus callosum. Even we may have hollow prosencephaly. Not only kidney anomaly, the person with Kallmann syndrome may have heart disease like cardiomyopathy. Micropenis, small size penis, or cryptorchidism, undescended testis. Synkinesis, mirror movement, one side of the body moves, other side moves same. Infertility, both female and male will be sterile because male will not develop testis, no sperm. Female, no ovary, no ovum. Absent secondary sexual characteristic is also a feature of Kallmann syndrome. Diagnosis and treatment of Kallmann syndrome. Okay. Diagnosis of Kallmann syndrome involves through clinical evaluation, hormone testing like gonadotropin releasing hormone, follicle stimulating hormone, luteinizing hormone, imaging studies for any anomalies like that of the brain. Is there any problem in the corpus callosum? Is there any hollow prosencephaly? Is there any type of cleft palate? Okay, kidney, by imaging study ultrasonography, we may find out any renal agenesis, horseshoe-shaped kidney, or pelvic kidney. Okay, and we need the genetic testing to identify mutation in relevant genes. Treatment typically involves hormone replacement therapy to induce puberty and address fertility issue. Okay, so if only a few sperm is present, then we may use that for in vitro fertilization. Also, if a few ovum can be extracted, that can be used in artificial way to fertilize. Management may also include olfactory training to improve the sense of smell. Early diagnosis and intervention can significantly improve the quality of life for individuals with Kallmann syndrome. Okay, we got that. And that's all about Kallmann syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.